I would just like to thank the course directors, Drs. Mundi, McMahon, and Dr. Hensrud for inviting me. This is truly one of my favorite conferences to attend and speak at. I'm going to, as Dr. Mundi said, I'm going to speak about bariatric surgery. I have nothing to disclose. And I'm going to start by making a distinction that I haven't always had to make, and that is between bariatric operations and bariatric procedures or endoscopic procedures. And my colleague, Dr. Storm, will speak after me to that end. But when we speak of operations, we're speaking of laparoscopic operations probably 90% of the time, 99% of the time for primary bariatric operations. So I just want to make that distinction. Sometimes procedures is mixed up with operations, and really the operations are speaking to surgery itself. So as you can guess, and as I'm sure you know, the number of bariatric operations have been increasing over the years, and the current number is somewhere over 250,000. And that is, of course, in response to the increasing safety of surgery, but also to the increasing scope of the problem, obesity in the U.S. Unfortunately, insurance coverage hasn't really kept pace, and in fact, there are a number of individuals out there who have poor bariatric surgery coverage or no coverage at all, such as in a trimmed-down insurance coverage plan. But hopefully we can change that in the future. I'll start by talking about candidacy criteria for bariatric surgery, and most of you know this because unfortunately it hasn't changed for many years, but those with a body mass index greater than 40 kilograms per meter squared with or without comorbid diseases are candidates. Those in the BMI range of 35 to 40 kilograms per meter squared with generally two or more comorbid diseases are candidates. And then there's this third group that isn't currently a candidate, at least not in many places, in that BMI of 30 to 35 range with comorbid diseases such as diabetes. And there are plenty of data available to support doing these operations for improvement of comorbid diseases like type 2 diabetes in this BMI group, but it hasn't been widely accepted to date. As I said, unfortunately, the use of bariatric surgery worldwide is largely governed by an NIH consensus statement that was actually published 30 years ago now. And if you think since that time, obesity has been designated as a disease by the NIH in 1998, the Obesity Society in 2008, and now most recently the AMA in 2013. Also, there have been multiple randomized studies demonstrating safety and efficacy of bariatric surgery. And you add that to the increasing scope of the problem of obesity in our country and its huge cost of healthcare, and it's a wonder to me why we haven't yet revisited those guidelines.